Dr. Jane Morgan, good morning to you. All right, let's start with and let's put RSV in there as well. We've got COVID, flu, RSV trending upward. I remember talking with you at the start of fall about the fears about a tridemic of these three. Is that what we're seeing, or are these the expected surges of this type and this time of year?
Actually, we're seeing both. And what is happening is that people may be getting successive infections. In other words, you're infected with one virus, let's say the flu. And as you're recovering, you actually get infected with a second virus, something different, maybe COVID, maybe RSV, and your symptoms then linger and prolong. And you think it is one thing that is going on and on and on that is not, from which you're not recovering. But in fact, you're being infected with multiple viruses. And when you are infected with one virus, it lowers your immunity and makes you more susceptible to other viruses as well. And this is what we are seeing sometimes, multiple infections, and people are unaware of that.
The JN1 variant of COVID now is the leading cause of COVID infections in the U.S. That has been on a pretty remarkable trend upward, considering the percentage of people who were contracting JN1 just a couple of months ago. What do we need to know about this variant? Any different than the others that we've faced?
And you're absolutely right, Victor. It's on a remarkable trajectory. So far, it is still a variant of interest by the World Health Organization, so we're keeping an eye on it. The symptoms don't seem to be remarkably different from any of its sisters and cousins and relatives within this Omicron family. However, it does have advantages in that it is taking over the rest of the family. So it is more infectious and more susceptible, and therefore has some evolutionary advantage. It remains to be seen whether or not it can evade some of our immunity. And so we're keeping an eye on it as a variant of interest, but you're absolutely correct. It is increasing. And as we see these hospitalizations increasing as well, it's something to watch.
This is a really bad time of year for this next one to be happening because these viruses can trigger asthma attacks. Manufacturer GSK is going to discontinue the production of the inhaler Flovent. And this is starting Monday, starting at the beginning of the new year. The company is going to make what's called an authorized generic version, but that one does not appear to be covered as widely by insurance, so patients may have to use some alternatives. What's the significance of this change?
And this may be of some concern. And actually, GSK created these authorized generics really back in October and have been rolling them out. The issue that patients will face is that often you don't have your inhalers refilled every 3 or 4 months. And so within that interval, since October to January, you may not have had a refill. And by the time you get a refill in the new year, that's when you discover that your medication has been discontinued. And even doctors may not have awareness of it. The good thing, if there's a positive in this, is that the generic should cost less for patients. However, when we look at the other side of it, it may be difficult to find and difficult to source, but also it may not be covered by insurance carriers, may not yet be on the formulary, these generics, and so may cause some interruption in patients who are dependent on these medications right at a time when our winter viruses are increasing and these viruses trigger asthma attacks.
All right, Dr. Jane Morgan, this is our last interview of the year, so you have a happy new year.
Happy New Year to you too, Victor.
All right, see you in the new year. Just ahead, a civil rights